the nation's commercial capital. This is the news at 10, live from Channels Television. Reporting tonight, Amarachi Ubani.
Good evening and welcome. Tonight, World Health Organization backs use of ZMapp vaccine for the treatment of Ebola virus disease. Presidency replies northern leaders over ultimatum to President Jonathan, says action is uncalled for. INEC fixes October 11th for Adamawa governorship election as political parties prepare for the exercise. And thousands of civilians trapped in northern Iraq following 10 days of fighting between Islamic sect and Kurdish troops. While on business news tonight, market watchers forecast a 0.1% increase in headline inflation rate for the month of July.
And tonight on sports news, one more trophy in the cabinet for Spanish giants Real Madrid as they defeat Sevilla 2-0 to win the UEFA Super Cup.
Gloria Umezuke, and from Abuja, Department of State Security attributes success of W.H.O polls to heavy security presence, asks politicians to leave law enforcement officials out of politics.
Begin with the latest from the World Health Organization. Tonight, patients who have been diagnosed with Ebola virus disease in West Africa can now at least be sure of a stronger treatment, as the World Health Organization today gave backing to the use of experimental drugs or vaccines. Announcing this today in Switzerland after medical experts met to discuss the issue, Dr. Marie-Paul Kieny of the WHO said that this has been a unanimous agreement among the experts, but that provision of experimental Ebola drugs required informed consent, freedom of choice, confidentiality, respect for the person, preservation of dignity and involvement of the community.
There was unanimous agreement among the experts that in the special circumstances of this Ebola outbreak, it is ethical to offer unregistered interventions as potential treatments or prevention.
Well, back here, commercial drivers have been directed to demand for medical reports from sick passengers before conveying them to their destinations. This is part of efforts at containing the spread of Ebola virus disease, according to the Minister of Health, Professor Onyebụchi Chukwu. Road transport owners have also been advised to seek for a certificate of waiver for corpses before being transported from one part of the country to another. The minister handed down these directives at a meeting with road transport owners in the nation's capital, Abuja.
Conveying people, goods and services from one point to another is an activity that cannot be avoided as it leads socio-economic development. But the federal government is also mindful that the movement of people be checked to avoid the spread of the Ebola virus in the country. After ensuring adequate screening at airports before and after departure, the federal government has come up with a policy to check the land transport system.
We discuss with them the role they can play, which has to do with identifying sick people who are entering their vehicles and insisting that once you are sick, you must have a medical report so that they know what is wrong. So that if it's any of the diseases like Ebola or Lassa that can affect other passengers in a crowded car or bus, then they won't take you. So that is one. We also let them know about movement of corpses, that before they move corpses across our borders, they must have waivers. Otherwise, if the person cannot show a waiver, since we have banned movement of corpses, then they shouldn't carry.
While the newly introduced effort at managing the spread of the Ebola virus through land transport is described as a welcome development, members of the Road Transport Owners Association believe that the provision of gadgets that could check passengers' temperatures is also necessary.
Our call to the government is to make available those facilities in large numbers and then train some of our people on how to use them. That will at least reduce the problem of manpower, the problem of manpower that we've experienced by the federal government. At least we have people now that will be doing it voluntarily.
Further engagement between the federal government and Nigerians involved in road transportation still continues. Many Nigerians agree that the latest policy would check the spread of the virus.
Well, Lagos State Governor Babatunde Fashola is appealing to religious and traditional leaders as well as local government chairpersons to report any suspected case of Ebola in their constituency. In a meeting with the various groups, the governor explained that the disease is highly contagious and timely reporting will help contain the spread of the virus.
Recognizing the influence of religious and traditional institutions, the Lagos State government has begun an alliance with religious and traditional leaders in their battle to contain the spread of the Ebola virus disease.
If there is anybody who is a member of the congregation who is with us, they don't need to stay in church. The risk of spreading the disease in church is high. So this is the time to increase our sanitation habits. Help us spread the message of open defecation, open urination to stop.
Once you suspect anybody, leave them where they are. Maybe they will just leave them locked up and call our toll-free number. Go to our ambulance and our team to come and assess that person.
The need for protective gear in dealing with possible carriers of the virus is stressed in another meeting with the local government chairpersons and health personnel.
Some of them were not wearing gloves. So this is information. So you are not necessarily at risk because you are a health worker. You are at risk because you are a health worker who does not take precautions. So you must wear your gloves, as you say, if you want to triple it. And I will add your mask. So local government chairman and vice chairman, first duty, make sure that these equipment are in supply in all the primary healthcare centers.
The Lagos State government says it's still tracking secondary contacts and is appealing to all citizens to reach the government using the Ebola helpline to report any suspected cases.
The new Minister of Aviation, Osita Chidoka, has committed to the implementation of the Aviation Master Plan and Roadmap, as well as the creation of understanding and alignment in the industry. Mr. Chidoka, who made this known in Lagos at the end of a two-day tour of aviation infrastructure and consultations with stakeholders in the sector, said the overall objective is to ensure safety of air passengers.
He may have toured a reasonable percentage of the nation's highways while at the Federal Road Safety Corps. Mr. Osita Chidoka knows very well that the aviation industry is a different turf entirely.
We have already ensured that no people can.
3 weeks into his administration, he is in Lagos, Nigeria's aviation hub, to inspect airport infrastructure and ongoing projects, both at the international and local wings of the Murtala Mohammed International Airport. Having seen what is available in terms of facility and manpower, the minister went into a closed-door session with stakeholders in the industry to discuss policy issues.
Licensing and what to do.
After that meeting, Mr. Chidoka fielded questions from aviation correspondents bordering around manpower training, security, quality of facilities, ongoing projects, airlines, a national carrier, and the Ebola virus issue.
I want to assure all Nigerians that our commitment to keeping our airports Ebola virus free is a total commitment. It's a commitment that has the alignment of both the unions, the agencies, the operators in the industry, and also the staff of the industry.
For those questions yet to be answered, Mr. Chidoka promised to consult with his team of professionals for solutions, but restated the federal government's commitment to the growth of the sector.
We want to say that we will go back, review all that has been said, align it with what is in the master plan, and come up with that implementation schedule. And before we do that, we're going to brief Mr. President on the journey so far, on the issues before the industry, and what needs to be done.
The minister left with a promise to provide a timetable for the actualization of his administration's plans for the industry in the nearest future. Henry Ogunjimi, Channels Television News.
Well, the Spanish priest being treated for Ebola has died today in a Madrid hospital. Spain's health ministry said yesterday it had obtained a course of the U.S.-made experimental Ebola drug Z-MAP to treat Father Miguel Pajares. Father Pajares died today at Carlos III Hospital. The hospital would not, however, confirm that he had been treated with the drug. The Father Pajares, who was treating people with Ebola at the San Jose de Monrovia Hospital in Liberia when he became infected, was evacuated to Spain on Thursday last week. He worked for the San Juan de Dios Hospital Order, a Spain-based Catholic humanitarian group that runs hospitals around the world. In part two, after the break, federal government says the emir of Gwoza in Borno State survived the recent Boko Haram attacks. That's in a moment. Please join us again.